Hey everyone, and welcome to today's Explainer. I am absolutely thrilled to have you here. So, our mission today is to uncover the crucial but honestly often missed early warning signs of a highly elusive medical condition, pancreatic cancer. Now, I know it's a heavy topic, but understanding exactly how our bodies communicate with us, that is literally one of the most empowering things we can learn. We're going to decode those really subtle, quiet signals your body might be sending and translate them into knowledge that could quite literally save a life. Okay, let's dive right into this. I want you to think about something as incredibly common as a backache. I mean, we've all had one, right? Maybe you just slept funny or you lifted a heavy box. But what if that ordinary, everyday back pain isn't about your muscles or your spine at all? What if it's actually an internal alarm bell, a literal SOS from deep inside your body? Today, we're going to completely challenge how you think about everyday ailments and show you exactly how to spot the difference between a harmless ache and a critical warning sign. So here is our roadmap for today. First, we'll look at the silent killer. Then we'll move on to unusual back pain, followed by skin and digestive clues, weight and blood sugar, and finally, we'll wrap up with action and prevention. All right, Section 1, the silent killer. Let's understand the threat we're dealing with. To put this into perspective, let's look at Japan, which records some of the highest rates of this disease in the world. Their 5-year survival rate sits at a really harsh 8.5%. It's a sobering statistic for sure, and it really anchors the sheer danger of this disease. But why is it so low? Well, because in the vast majority of cases, by the time symptoms become obvious enough for someone to actually go to the doctor, the tumor has already grown significantly, or it's spread to other organs. So early detection isn't just helpful here, it is absolutely vital for survival. And the main reason it's so incredibly stealthy really just comes down to real estate. The pancreas is what medical folks call a retroperitoneal organ. Basically, it's tucked way in the back of your abdomen, hiding right behind your stomach and sitting just in front of your spine. Because of this deep hiding spot, if a small tumor starts to grow, you can't feel a lump from the outside. Doctors can't even easily palpate it during a standard physical exam. It just kind of grows in the dark, completely unnoticed, until it gets large enough to physically push against the organs and the nerves surrounding it. Moving on to Section 2, unusual back pain. Let's decode that SOS signal. So the crucial point is distinguishing normal pain from something more serious. A normal backache, say from a pulled muscle, generally gets better when you rest, when you lie down, or when you fix your posture. But a pancreatic SOS, entirely different. Because the tumor is sitting right in front of your spine, when you lie flat on your back, gravity actually pulls your organs down, pressing the tumor directly into your spinal nerves. So the pain actually gets worse when you lie down. On the flip side, patients often find that leaning forward temporarily relieves the pain by pulling that pressure off the nerves. It's this dull, persistent ache that completely ignores the traditional rules of muscle pain. To really understand this mechanical pressure, think about the late actor Patrick Swayze. On New Year's Eve back in 2007, he took a sip of champagne and felt this sudden, agonizing pain in his abdomen. He described it as being like acid was poured on a wound. So, what was actually happening there? Well, when you eat or drink, your stomach expands. And because the stomach sits right in front of the pancreas, a full stomach literally pushes against the pancreatic tumor, causing a massive spike in pain. Tragically, Swayze was diagnosed with stage 4 pancreatic cancer just a few weeks later. Okay, Section 3, skin and digestive clues. Let's look at some visible chain reactions. Now, a lot of this comes down to a substance called bilirubin. Bilirubin is a yellow pigment created when your body breaks down old red blood cells. Normally, your liver processes this stuff and just flushes it out through your bile ducts into your digestive tract. But if a pancreatic tumor is pinching that bile duct shut, the bilirubin has nowhere to go. It completely backs up into your bloodstream and circulates all over your body. When it finally reaches your skin, it causes jaundice, which is that yellowing of the skin and eyes, and it causes this incredibly intense, unexplainable itching. And this isn't just theory, right? It plays out in real life. Take this crazy story of a 62-year-old guy who started getting this severe, maddening itch on his back. There was no rash, no bug bites, just this invisible itch. One night, he asked his wife to rub some anti-itch cream on his back. While she was doing it, she noticed his skin had taken on this bizarre yellowish tint. That simple observation sent them straight to the doctor, and it resulted in a stage 2 pancreatic cancer diagnosis. The cancer was caught early, all because of a stubborn itch that no moisturizer could fix. And this brilliantly illustrates what happens in the bathroom, too. If bilirubin backs up, your kidneys try desperately to filter it out, which turns your urine a dark cola or dark tea color. Meanwhile, without that brown bile making it to your digestive tract, your stool can turn pale or ash-colored. Plus, because the pancreas can't release its fat-digesting enzymes, fat just passes right through you. This results in steatorrhea, which is fatty, floating stools that are, well, stubbornly resistant to a polite flush. These are absolutely massive warning signs. Section 4, weight and blood sugar. Let's talk about these sudden metabolic shifts. The first major metabolic shift is sudden, totally unexplained weight loss. We're talking about dropping, say, 5% of your body weight in a single month, without changing your diet or exercising at all. This happens for a couple of reasons. Physically, the tumor can press against your stomach, making you feel full after just a few bites, or even causing nausea. But on a cellular level, cancer cells are aggressive. They hijack your body's energy supplies, breaking down your muscle and fat stores just to feed themselves. And that leads to this profound, bone-deep fatigue that, honestly, no amount of sleep can fix. The second major shift happens with your blood sugar. See, your pancreas is essentially the factory that produces insulin, the hormone that regulates your blood sugar. When a tumor attacks the pancreas, it destroys those insulin-producing cells. This can actually trigger a sudden onset of diabetes, particularly in folks over 50 who have absolutely no prior risk factors. Or, if someone already has well-controlled diabetes, their blood sugar might suddenly just spike out of control. You'll see this manifest as extreme, unquenchable thirst and frequent urination. It's basically a blood sugar crisis masquerading as standard diabetes, but the root cause is actually a tumor. Finally, Section 5. Action and prevention. Let's pivot to some proactive steps. Let's move to and see how this builds your actionable response plan. Step 1 is self-awareness. You really have to monitor your body for that strange back pain, the invisible itching, or those weird bathroom changes. Step 2, consult a doctor immediately if you spot multiple signs. And please don't let them dismiss it as just getting older. Step 3 is vital. You have to advocate for yourself by requesting specific screenings. Ask your doctor for an abdominal ultrasound or a CT scan, and specifically request a blood test for the CA19-9 tumor marker, which is used to help detect pancreatic cancer. But hey, you don't have to wait for symptoms to show up. Quitting smoking is your absolute biggest lever here. If you do it, incredibly, your risk plummets to that of a non-smoker within 5 to 10 years. Also, try to keep your BMI under 25 to reduce visceral fat. Eat a diet packed with veggies and whole grains. Get in your 150 minutes of exercise a week, and heavily reduce, or ideally just eliminate, alcohol, which constantly inflames the pancreas. And, thanks to lifestyle changes and the amazing awareness raised by public figures like Patrick Swayze and Steve Jobs, the 5-year survival rate in some regions has actually recently climbed to 11%. So progress is definitely happening. I want to leave you with this one provocative question. Are you really listening to the quiet signals your body is sending you? Pancreatic cancer is known as the silent killer, but as we've seen today, it isn't entirely mute, right? It whispers. It whispers through a dull backache, a stubborn itch, or a sudden drop in weight. So share this explainer with your family and your friends. Start a conversation that could lead to early detection and literally save a life. Stay focused, stay curious, and please, never ignore your body's subtle SOS.